Hi, my name is Kersten Lara from Paso, and today we're going to be talking to Art, who is a psychotherapist from the VA. So tell us a little bit about yourself.
Well, I've been practicing psychotherapy for about 15 years. Before that, I was working in research. We were looking at some of the illnesses that are like the heavy-duty type of illnesses like schizophrenia and bipolar disorder, and we were trying to find genes that made people have these illnesses. So I have a little bit of experience in treating those type of illnesses, schizophrenia, bipolar disorder, PTSD, depression, that kind of stuff. And over the past few years, I've been I switched roles just a little bit, and I've been working with a little bit more with what we call health psychotherapy. So I've been helping people that have some of these chronic illnesses like diabetes, or helping people quit tobacco, manage weight, and that kind of stuff. So I have a little bit of a varied background, which is I really enjoy everything I've done.
What made you interested in all of this?
Well, something that all of us have when we go into this field is that we have a desire to help people. So I remember in high school and talking to some of my friends, I was like, I'm not really sure what I want to do with life, but I want to be in a place where I can help people. And so that led me to study a bachelor's degree in psychology, and then to practice psychology or as a psychotherapist, you have to have a minimum of a master's degree. So there are no masters in psychology that offer a license. So my master's degree is in clinical social work. So you study a bachelor's in psychology, then a master's in something related to psychology, like clinical social work. You get a license, and then if you're lucky, you get hired by the VA, and you work with veterans in this great environment.
Was it difficult to get where you are right now?
I wouldn't say it was difficult. I would say it just takes a little bit of perseverance. I mean, I had to apply a few times, and several times I wasn't selected. But you keep applying, and you know, eventually you'll find a job that suits you. I was offered some other jobs, and I was thinking, no, I don't really want to do that. So you kind of find what you want to do, and then go from there.
What made you decide, like, oh, I want to help people? Like, this is what I've always wanted to do. Like,
well, I have been a Christian all my life, and talking to people and realizing that there are a lot of people that need help. There are a lot of people that get really sad and they become depressed, and there are ways to help those people. There are sometimes people get really anxious, for example, and there are techniques, there are ways to help these people. And so I just really I think it all is born out of compassion. When you feel compassion for people, then you want to take it to the next step and be in a position where you actually get paid to help people, which is really, really good. I mean, I still can't believe sometimes that I get paid to do something that I love to do.
do you think that caring too much about others can be a disadvantage?
Yes. There's something called compassion fatigue in my field, where sometimes you get so involved with helping people that it starts affecting you. When I was doing a lot of clinical work, so back-to-back patients all the time, sometimes I would, and this was especially at the beginning of my career, where you get so involved with the problems of the patient, and you begin to feel empathy, which is different than sympathy. And empathy is where you really try to feel what the other person is feeling. Then you get really enmeshed or involved with the issues of that person that you're talking to. But then you finish that 1 hour session, and that patient leaves, and then there's somebody else waiting for you, and you just kind of have to shake yourself off and say, okay, because that other person needs you to be 100% also, and be disconnected from the previous patient, and give 100% of your attention to the next patient. So yes, sometimes you can get so involved with a patient that you can get what we call compassion fatigue.
Do you personally ever feel overwhelmed by the fact that you need to help everyone now?
I guess at this stage in my career, I don't feel that as much. I do remember, for example, one time when this was about 10 years ago, the first time when I had been working with somebody, not very long. I saw him in the emergency room because he had PTSD and he was feeling very bad about himself. And I worked with him there. Then I worked with him only once after he got out of the emergency room. And then he stopped coming. Like, that happens often. About 2 months after he stopped coming, the second time when I saw him, somebody told me that he had killed himself. And so that was very difficult for me. I didn't think it was going to affect me that much, but it actually affected me a whole lot. I couldn't work with patients that day anymore, and I talked to my boss, and we agreed that I was going to take some time off. And I took a whole week off just to go home and think and talk to some of the people that I trust. But sometimes it can get like that, and so you have to be strong because everyone needs you. Your patients need you, so you have to be strong for yourself and for them too.
That sounds like a lot.
It is. So sometimes what I see is that there are some people that come into this profession because they themselves have problems, and learning about how to treat these problems, they feel that is going to help them. But you really have to know yourself very well and have a level of comfort with what your issues are, and be able to disconnect from that so that you can offer yourself to the patient.
Yeah. Do you think that therapy is something that everyone should go to at least one point in their lives?
I don't think it would hurt. But definitely those people that have issues, and I have a famous saying in my field. It's kind of a funny saying. A problem is not a problem until it becomes a problem. And by that I mean, it's okay to be sad every once in a while. But if that sadness begins to affect your life, you're not going to school, you're not showering, you're not eating, or maybe overeating, you're disconnecting from your friends and all of that. So it's okay to be sad, but if that sadness begins to affect your life, then it's time to see somebody.
What do you think that is when someone starts letting that happen to them, or they feel low energy and like don't want to get out of their bed? And what do you think that is?
So that's the difference between being sad and being clinically depressed. So I know that the word depression is something that we use like in our everyday kind of language, but it truly is a medical diagnosis. So if you're sad, there's normal fluctuations of mood, and so sometimes you can be a little happy, sometimes you can be a little bit sad. But if it's within the norm of mood going up and down, that's normal, right? We all get a little bit happier or a little bit sadder sometimes. And there's a few diagnostic criteria that we use to say, okay, you're more than just sad, now you are depressed. And that's when these symptoms that are affecting your life, in the case of depression, for example, last for at least 2 weeks. If during 2 weeks, every day, you haven't been able to get out of bed, you feel very low energy, you feel unmotivated, you have crying spells, you are overeating or not eating, and especially if you're having thoughts of life isn't worth it anymore, and if those symptoms persist for at least 2 weeks, then we say that you have clinical depression.
Do you think that how do you personally get people to open up to you?
Well, one thing I find amazing about my job is that as soon as people come into my office, they know that they are here to talk, and they know that they are here to open up. So my job when it comes to that is very easy, because when you have that mentality that you are going to talk to this person, people go in there, and I am always amazed at how many times people tell me things that they haven't shared with anyone else in their whole lives, because they know that that's my job. So as humans, once we know that his role, or my role in this case, is to listen to you, then we open up. So this is when I think that a lot of us, you were asking earlier if everyone should go to therapy, a lot of us have the need to be listened to be not just heard, but really listened to and understood. And that's what we as therapists do. We are trained to listen to people, and everyone likes to be listened to. So in my job, it's when they understand that my job is to listen to them, they just come into the office and they tell me what the issue is, and so that part is not very difficult at all.
Do you think that it's bad when someone's distracting themselves from their problems and not wanting to admit that they're just holding everything in?
Well, that's a very interesting question. To some degree, it's okay to distract yourself if you're having, I don't know, issues with your mom, with your teacher, with your friends, and sometimes you say, I don't want to think about this too much, and you kind of distract yourself and you, I don't know, read a book, go to the movies, talk to another friend or something like that. Then that's probably okay. If there's a nagging problem that you have to deal with, and you're using those strategies to sort of not deal with the problem, then that's probably not a good thing.
When it comes to your clients, do you mainly like to focus on what's currently happening in their lives, or do you like digging in on their past selves?
That's a great question, and that has to do with the perspective that as a therapist you have. There's many different schools of thought, so many different ways of looking at problems. And because of that, there's this different strategies that different therapists follow. So some people like to say that they concentrate on a specific modality, like cognitive behavioral therapy, for example. So in that type of treatment, on cognitive behavioral therapy, you don't go into the past too much. You kind of think about what people are thinking, and what those and sometimes errors in thinking or mistakes of thoughts lead people to have different problems. So if that's your background, cognitive behavioral therapy, then you're going to talk to the patient from that perspective, and you're going to say, okay, well, tell me about what you were thinking when this happened. There are other people that there's other schools of thoughts, like psychoanalysis, for example. In that modality, people would want to know, so I'm having this problem with my wife, for example. So the therapist would say, okay, well, let's talk about your childhood. How were you brought up, and what kinds of things you learned? And so I guess depending on the type of schooling that you have, and there's many other different types of modalities for different illnesses. That's kind of like what you're going to use. There's a beautiful sort of newer modality called motivational interviewing, where you kind of are going to try to find what drives the patient, what is important for the patient. And so then that's going to be the treatment that you use. So I guess depending on who you are, what kind of experience you had, where you went to school, what you think as a therapist holds more water or is more important, that's kind of like how the session is gonna flow for that patient.
What are some signs that someone can look at and notice, like, oh, I'm not doing too good right now?
I guess the most important sign is if it's affecting your life. If it's affecting your life, if you're not doing what you're supposed to be doing, then that's a sign that you probably need help. Being a little bit anxious, getting mad, making mistakes, doing bad in school, that could be part of normal behavior, or not. So, but if someone is having those type of issues, talking to the school counselor, for example, is a great way of trying to decide, should I go farther with my treatment or this part of normal behavior? Because a lot of the times what we humans struggle with is to know if I'm normal, right? Is this okay, or is this something that I need help with? And so talking to a school counselor is a great way for younger people to decide if further treatment is needed, or if I'm doing okay.
What is something that you see most teenagers dealing with when they talk to you?
Well, at the VA, I don't get to talk with a lot of teenagers because we deal with people that have been in the military. So by the time we get to see them, they are already the youngest in their early 20s. But we have people that went to Vietnam, for example, or Korea, the Korean War, or we even have some people that went to Second World War still. So the people that I interact with, mostly the patients, are either younger adults or older adults.
What are issues that they mainly have?
At the VA, we see a lot of people that have PTSD, so post-traumatic stress disorder. This is an illness where people are affected because they have experienced a heavy trauma, a situation where people could have died, for example. You're under combat, or your Humvee gets blown up. And so as a result of that trauma, you come back to civilian life, and now you're struggling to readjust to this environment that is not as dangerous as it was, for example, when you were in Iraq or in Vietnam. So we see a lot of PTSD, we see a lot of depression, but veterans are not much more different than anybody else in that regard. So, our share of schizophrenia and anxiety disorders. We also see a lot of substance use, tobacco. A lot of people that went to Vietnam and were exposed to an agent that they were using over there, a chemical agent called the Agent Orange, are now having illnesses like diabetes or hypertension and things like that.
How do you think someone, if they're having an anxiety attack, what do you think they should do?
Well, the number one thing I would want to know is, I would want to know the type of anxiety attack. If it really is an anxiety attack or a panic attack. A lot of times we get frustrated and we may throw something at the wall. Or sometimes we may get really scared because of something that might be happening, either real or perceived in your mind, and we may get really, really anxious. So the first thing I would want to know is talk about that event, what is happening, and try to decide if this is truly a panic or anxiety attack, or if it's just a normal reaction to something that is happening. I mean, if somebody comes, and wants to come into the house and they're trying to bang on the door and they're trying to break it, I would say it's perfectly normal the next day somebody comes and knocks on the door without you expecting that person, for you to feel, to have very strong emotions about that. Now, is that a panic or anxiety attack? I would say no, it's a normal consequence of what happened a few days before.
So if someone were to randomly start shaking and freaking out and feeling like they can't breathe, what would you consider that?
Yeah, so a real panic attack has to do with those symptoms that you mentioned. So people sometimes tell me that they feel like they're pressing on their chest and they can't breathe. Their heart begins to race, so that would be another symptom that I would be looking for. Sometimes people begin to sweat, and sometimes people begin to shake. So I would be looking for those symptoms. And then also, how scared were you? Did you feel that your life was in danger, for example? Did you feel that if that continued, that you might die, for example? So now we're getting into what is a real panic attack, especially, like you said, if there is nothing going on that would have triggered that. Now, having said that, panic attacks are not uncommon, so lots of people have them, and they are not necessarily very dangerous. I mean, nothing it's going to happen. Probably if you have like a heart condition that, already, maybe that's something to be worried about. But in a medical context, if you get really worried and your heart begins to beat a little bit faster, it's scary for the person having it, but it's probably not life-threatening. And so just trying to be safe, number one, and most of the time, after a couple of minutes, that high anxiety and feelings is going to start to come down little by little, and then you're going to be okay. So if that's an issue, I would say talk to somebody, talk to a specialist, because there are ways that therapists can help with that. There's medication that people can take that us therapists we don't prescribe. That's something for a medical doctor or a psychiatrist to prescribe. But a therapist can help that person going through those symptoms by trying to understand what the thoughts were that may have led to that panic attack.
What are your thoughts on feeling isolated and lonely, even when you're around a bunch of people?
Well, that's an issue. We should not be feeling isolated and lonely, especially when you're with a bunch of people. Now, one of the things that teenagers are struggling with is this need to belong to a large group, to a larger group. The younger years are a time when we all go through that. I went through that when I was younger, where you're trying to find out, what am I doing in this world, and who am I, and what am I going to become. I was really worried when I was younger of what I was gonna be later on in life. And so that's a scary time for a lot of us. Now, social connections in the younger years are very, very important. I mean, we're growing up and we're 5 and 8 and 10 years old, and our parents are the biggest influence in our lives. But when we get to be into the teenage years, 12, 13, 14, 15, then parents are still important, but then our friends begin to take on even more of importance. And so when things happen with our friends, it really affects us. And sometimes our parents don't really understand all the dynamics that are going on with our friends. So it would be easy to feel isolated and alone if you are even in a group of people, if you don't feel that connection with your friends.
Do you think that self-love is an issue around 10 to 18, around those years?
Yeah, self-love is an interesting concept because you can love yourself, and there's a song by Justin Bieber, right? just love yourself. It's a cool little song. Very nice guitar parts to it. You have to be able to love yourself. I mean, even the Bible talks about loving yourself. I mean, Jesus said, the greatest commandment is you have to love God. But the second commandment is you have to love your neighbors as you love yourselves. So, as if saying, you first have to love yourself in order to be able to love others. Mm-hmm. And so if you don't love yourself, it's going to be really difficult to love others.
Right.
So loving yourself is part of loving others and loving God. if you don't love yourself, then I would say that would be a big symptom of depression that probably needs to be discussed, because now we may say sometimes that we don't love ourselves, but in reality we shower ourselves, we fix our hair, we brush our teeth, we fix our teeth with braces, we wear makeup, and because we're taking care of ourselves, we feed ourselves. Because we are taking care of ourselves. So when people say that I don't love myself, I kind of look at them and like, wow, you look pretty nice. You're taking good care of yourself. So sometimes, just like we make mistakes in driving, for example, or we make mistakes in taking the wrong medication, we make mistakes with friends. Sometimes we think a friend is a good friend, and he turns out to be not a good friend. We also make mistakes in thinking. And so therapy is a good way of finding out if you're thinking correctly about this. So sometimes people that say that they don't love themselves, they truly do love themselves. Now, if you truly don't love yourself and you hate yourself, you're probably gonna want to check out of this life, and so that's something that we need to discuss.
How do you think, what's some advice that you would give someone who is struggling with self-confidence and self-trust?
Advice, I would say, well, come and talk to me, or come and talk to somebody else. Come and talk to your school counselor. So self-confidence, again, you can have too much self-confidence, and you probably have met some people that feel too self-confident, and they kind of come across as what? As cocky, egotistical. That's because they have way too much self-confidence in what they can do. And then you have people on the opposite end, right? Oh, really? I can't do anything, and they're timid, and they're hesitant about everything. So somewhere in the middle, it's probably good, right? If you think you don't have a lot of self-confidence, I would say, think about what you have accomplished so far. I mean, were you able to, when you started the 7th grade or the 8th grade, did you think you were going to be able to do everything that you've done? Look at it. Look at all your past accomplishments, and so that might be a way for them to say, I have done all of those things. Maybe I'm not so bad. And the same thing goes with trust, like you were saying. I'm not sure if I can do that. Just going back and thinking about all the things that you have been able to do. Also talking about the fact that it's okay, it's normal to feel that you may not be able to accomplish something. And just going back and thinking, when you were able to accomplish that other thing, you probably felt like this at that time too. And so that might help to bring up a little bit of trust and a little bit of confidence, just in thinking of all the great things that you have been able to accomplish.
And that's art. If you like the interview, you could see the full interview on social media, on Facebook and YouTube, Elevateelpaso Teens.